We're here today with Lori Beer, who is Executive Vice President of Specialty Businesses and Information Technology at Wellpoint, known to most of us through its Blue Cross Blue Shield subsidiaries. Lori, thanks for being with us.
Thank you, Michael. It's great to be here today.
So, Lori, in order to transform a healthcare insurer, do you also have to transform healthcare providers and healthcare patients? In other words, are you somewhat at the mercy of things beyond your control?
The whole value chain of healthcare, as we look at how do we try to solve the problems, improve our processes, we have to look at all the other stakeholders across the value chain. I'm going to start with providers. What we're really doing there, because we're at the heart of reimbursement, is looking at new ways to incentivize providers to drive high quality, affordable healthcare. That's the #1 issue we have for consumers today. We also know that this industry has not really had an efficiency transformation. And so really working with providers on reducing some of the administrative burden so we can all be more efficient, that's another key point as well that we focus on. From a consumer perspective, we really have a challenge. Most of healthcare today is sold through employers. And so 80%, for example, in our business is sold directly to the employer. And many times the consumer is not even aware of what their health benefits are or how to even engage with them. So we really are looking at that issue end to end, looking all the touch points of a consumer. How can we help and engage a consumer? Many times today we see that consumers don't actually engage, and looking at how do I choose affordable quality health care? What are my options? Because first of all, they don't understand the true cost, and they haven't traditionally had to pay for it. So as we move forward, we're really trying to bring forward also the tools, the capabilities, and embed it in a process and a system that helps both providers as well as patients more effectively engage in healthcare so we can get the right decisions and choices made.
So as a organization, do the Wellpoint brands have to change the way that they interact with providers and with patients? Is it incumbent upon you to sort of nudge them along, or is there only so much you're going to be able to do in that process?
From a provider perspective, it really is working with them. We have to understand what are the problems that they're trying to solve, what will help them drive efficiency. Many times for providers today, they see many, many patients. They don't have a lot of time. One of the innovations we're focused on is how can we bring together the data and information we have about an individual person and share that data with them so that as they're looking at the patient, many times providers are only one resource in the whole value chain of healthcare that's seeing a patient. And so how can we bring them better information? How can we put the right rewards and incentives in place that if they help us in improving the health of a member or driving affordable quality care, they have the right incentives built in to support that. And that's how we really are partnering with providers.
You've noted that the healthcare industry is in fact shifting from this employer-based operation to being consumer-based, and that sounds like a radical transformation. Can you talk a little bit about what that actually means?
We are actually the largest provider of individual health insurance today. So we do know when consumers look at our products and capabilities, but as more and more shifts in this direction, it really starts with how do we help educate? We can't just answer the phone anymore and answer the question about the status of the claim. We have to be more of a concierge for them. When they call us, we need to help them with all the information about them as an individual. We have a ton of information. Since we really pay all the bills, we understand the pharmacy, the lab, the claims, where they've been. We know if someone's taking their prescription. It's not only information that we would provide a consumer, but also information to their provider. We send actually health alerts today to a provider that someone may be a diabetic and has not had their annual eye exam, so that when that provider is having a conversation with one of our members, they can follow up on those kind of requests. The other big issue, though, that we're focusing on is people are starting to use mobile technology to manage their lives. And there's been a lot of health apps that are out there, and they get used and then they get forgotten. So how do you really connect it into the system? One of our most popular applications is a provider finder. So today in that world, they can look up, what is the highest quality integrated with my benefits provider to go seek a treatment for. In the future, you can think about it, we can also embed these health alerts. I know I'm walking into my provider's office. Would I like the latest health alerts that I can share with my provider? How do we help them understand that if I need an MRI, this is the highest quality, most effective, most cost-efficient way to get that MRI? Those are the ways that we're thinking about engaging the consumer.
So you just said a lot there. Let's unpack that a little bit. Do you have to change sort of your marketing approach and use new technologies to get to these consumers?
Yeah, I think it's really interesting when you think about how do you market to the consumers that we're talking about. We see this trend anyway, and in fact we see a lot more alignment in today's business world between the chief marketing officer and the chief information officer. If so, absolutely, as we've thought about our presence on social media, how do we get to a balance when you think about health insurance too? And for it to work, you know, we need to think about a balance of, we need to take care of those that are chronically ill, but you need to have a balance in your pool of healthy people too. And so how do we think about supporting all those needs? How do we think about targeting and marketing our capabilities to support the individual needs of the consumer, and a lot more application into social media, web presence than we've thought about traditionally in this business.
On a practical basis, do you find that you are spending more time with the chief marketing officer here at Wellpoint?
Absolutely. For us, when we talk about mobile capabilities or web capabilities, if you think about that, it now has more of a marketing design flavor on the front-end design of those capabilities, and it is actually in our chief marketing officer organization that the consumer experience and the connection of all those dots are coming through. One of the biggest disconnects we've had in healthcare, when you look at the consumer experience, is it hasn't been connected. And so we're really spending a lot of time looking at that end-to-end consumer experience. That's where our consumer insights and research work is happening, and very much partnering then with the business leaders and information technology to drive a more integrated solution for the consumer.
Traditionally, information technology has been a kind of sort of passive partner or directed partner for businesses. Because of the nature of the transformation that's going on, that's really being forced upon all of healthcare, is this changing the dynamic that you had at Wellpoint?
Traditionally, we looked at IT more as a shared service, if you will. I mean, if you think about our products and services, at the end of the day, it's not like we're a consumer products company where you can put that product on the shelf. Our products and services really are supporting consumers, providing capabilities for employers, information, data, much more like a financial services type of scenario. So technology has always been important to our business, but it really is becoming much more strategic, especially today when you're seeing the emergence of new technologies. You're seeing a transformation of how consumers are engaging with technologies, and you look at an industry that has a huge opportunity to transform, pulling those pieces together, as well as where the healthcare industry really is right now.
Which of the technologies that are emerging do you see as mattering most for the changes that are coming down in healthcare?
There are leading technologies in healthcare, that's great, but one of the biggest challenges we have is information and data. And so when you think about 80 to 90% of all data in healthcare is unstructured. Traditionally, our capabilities haven't really addressed that really well. I like to boil it down very simply to say, we're looking at capabilities that is able to really sort through massive amounts of unstructured data, and it's growing. Most of the world's data has come up in the last couple of years. So how can we sort through that? You think about it from a patient perspective, especially somebody that's chronically ill. They're at multiple institutions, seeing multiple doctors. How do we get their single best record and organize it? So when I think about our fundamental principles around our key strategic imperatives around affordability, access to healthcare, and the consumer experience, there's a foundation of data that runs through all of those components. So mobile, social, web, those things are important. But some of the new emerging capabilities around how do we structure information, how do we get to meaningful insights at the point it matters to a provider, to a consumer, those are the things that are going to really matter. If you think about the adoption of technology in the delivery systems, we have to think about cloud solutions. Now we have to work through privacy, security, and those capabilities, but that's going to be important as well.
You've been involved with Wellpoint for quite a while, and you have a data-driven business. This is not the first wave of big data. It's just a nice clever name. When you are talking with your fellow executives about this, how much skepticism do you have to overcome, and how do you manage their expectations about what you can do? And I guess a third question is, what's different now?
So there's a lot of questions packed in there, and I'll unpack it for you one by one, starting with, we have talked about data in our business for a long period of time, but the way we've thought about it has been more in a traditional sense. How do I get to making sure and looking at data that I understand operationally, that I'm paying my claims on time, and those kind of things? What's not just new to our industry, but what you see emerging in business in general, is how do you use data and information to look at your business differently and have actionable insights as to how I might think about the products and services that are really going to make a difference, how I might think about differently. When I had an opportunity to run operations for a while, we really turned that upside down. We didn't look at some of the traditional service metrics, average speed of answer and things like that. We focused on why were customers having to call us back? How do we really take the rework out of the system and the process? What leading indicators could we see in claims coming through that we hadn't traditionally looked at? Those are ways that we're thinking about. So part of it is, and what you have to face as a challenge, not only in our business and industry, but on others too, is you have to look at your business differently. You have to think about the problem that you're trying to solve, and you have to work with the business very proactively to understand. Many times the technology organization can understand the potential of technology. We have to align with the business to understand that we're truly meeting their needs at the end of the day.
So when you look at unstructured data, I think you gave started to give an example of what I think would be an unstructured data problem. Why are people calling in? Is that an example of the kind of shift you're talking about with this move to sort of looking at unstructured data and what it can do for you?
Certainly there are opportunities in looking at unstructured data to understand how we can better service a member. There's a lot of other data. A lot of times, traditionally, we've looked at healthcare data and trying to provide the best service to an individual. We really know that the behavioral element is so important, and understand if someone's going to remain compliant with taking their medication, or how they may react to new drugs and treatments, et cetera. And so part of what we're actually trying to do too is, on the consumer front, is looking at other information we haven't traditionally looked at. What have then been their general patterns as a consumer? That's on that side. The bigger lever here is, when you think about real true cost in healthcare, is how do we get at the unstructured clinical information? If you think about what our nurses receive today when we're trying to authorize a treatment, or and partner with physicians around that, multiple pages of unstructured medical notes and information. But the bigger value, ultimately, when we think about driving affordable quality healthcare, is getting our arms around all this unstructured data more on the clinical side of things.
So, and practically speaking, how does that drive change? So does that, for instance, let you look at certain kind of patients and then tell them you should be seeing this kind of person, you shouldn't be seeing that kind of specialist? Or does it conversely allow you to look at a hospital system, a healthcare provider that's looking at team care, combining physician's assistants and registered nurses and pharmacists and doctors, and not necessarily having the patient see the doctor very often as a way to kind of cut costs?
Yeah, I think there's multiple perspectives on this. One is from a consumer or patient's perspective. It's really important that we support them in their care and not dictate, what doctors they should see. But many times when they call us and ask us, who should they go see, a specialist, et cetera, how do we give them the best information around, whether it's feedback from a consumer or those that have better quality results for the particular situation of the individual? The other thing we have to keep in mind here is that medicine is becoming much more personalized, especially even in oncology and cancer care, some of those areas, but that's going to continue to explode over time as well too. So when they call us to ask for that information, how do we help direct? In the payment innovation side with the provider, as we're looking at those new reimbursement models, this is really important. How do we give providers data on how things, how they're performing in terms of managing their population? What are some ideas, some of the health alerts that we could give them on their member population? we are all equally aligned that if they can help drive the best quality health care in the incentive-based reimbursement models, everybody wins. So this is where the paradigm is changing. How can we provide information?
Can you just talk about whether you're seeing signs that it will help reduce or slow costs? I mean, the U.S. spends 50% more of its GDP on healthcare than any other developed country, for instance.
Yeah, we are seeing signs, certainly, that that can change. In all of our pilot studies, we were so confident that it can move the needle that now we are doing this broadly in something we're calling patient-centered primary care across the enterprise, where we're actually incentivizing primary care doctors to do things that we traditionally haven't paid for. Care management plans, maybe email visits, some of these web visits that we're going to talk about, because we can see that if we can incentivize them to more actively engage, not in that visit, that few-minute visit they have with that member, but in the overall health of the member, they win, as well as we believe the patient wins in the end.
Can you kind of unfold that across your units all at once, or do you have to kind of go unit by unit in a negotiation process? And
yeah, when we looked at this issue, it's well documented that for payment innovation, people have done pilot ACOs, accountable care organizations, or pilot patient-centered medical homes. We actually made a pretty bold statement that we're out of pilot mode and we're really going to roll this across the country in all of our markets. That does mean that our local teams on the ground that work with the delivery systems, hospitals, doctors, et cetera, have to have those conversations around how do we get things aligned from a reimbursement perspective. And that is happening broadly as we speak today. And we just in January started rolling out our first capabilities, and they're staged. Because part of what goes along with that is not the agreement just on the reimbursement piece, but we're rolling out reports and data and information and even more technical capabilities, this longitudinal patient record over time. So again, they have that single best record of our data, bringing together their data as well. Those are some of the more advanced capabilities that are coming.
Wellpoint is well known for being the first commercial adopter of Watson, and that's also out of pilot mode. So tell us, how did the Watson project come about?
I really believe innovation in this industry is not going to just come from what we can do. We have to make it work across the whole value chain. We have to work with other partners to do that. So it really started with a foundational perspective that we work really well with IBM today. They're a great partner. And in this case, I actually had the opportunity to be on the set of the taping of Jeopardy! And so, I really believe that day when you looked at how Watson played Jeopardy!, it demonstrated this new age of cognitive computing that is so relevant. You talk to one of our doctors who has been involved in the Watson work. When he thought about how Watson was playing Jeopardy!, he said, that's how I think about treating a patient. I look at lots of options, and I always try to bring forward that recommendation on diagnosis or treatment based on the data I have and what I believe is the highest likelihood that that situation is correct. And so it really started from the perspective of the demonstration of the new technical capabilities. It started on a solid foundation of partnership. We actually then went to IBM. We weren't the only ones interested. We actually had to sell ourselves, kind of an interesting paradigm, turn it upside down. But if you think about the deep market share we have in our local markets, the ability to align it with our reimbursement strategies, it's not about just putting new tools and capabilities in, it has to work in the system, and that's really how we started the foundational of this partnership.
How did you sell yourself to IBM?
Well, part of it was understanding the reach that we have, right? So we provide healthcare benefits to 36 million Americans. That's 1 in 9 Americans. And when you look across all Blue Cross Blue Shield plans, it's 1 in 3 Americans. So as a Blue Cross Blue Shield plan, we have very deep reach, but it's also that density in the local market. How can you really move a market? Part of that is being able to have that local density. It was also a commitment from the top. We flew our executive team there to sit down and have the conversations, because something like an innovation like Watson, we're literally taking it out of, we were not only the first ones in healthcare, we were the first ones in any industry. If you don't have that alignment at the top of the organization, you're not going to be successful. And this was a new concept for us, but when you think about the big challenges we're trying to solve, it's going to take new innovations to be able to do that. And so that's really how we, got the support. We had to get the support at the top, both from IBM and Wellpoint, and we started our journey.
So did you have, a cognitive computing specialist on staff? How do you find these people to bring this to life inside your company?
Well, this is what's been really great about the partnership. One of the nurses that have been involved with us from day one, she actually will say, she started her nursing career not even using any technology, and now she thinks it's, phenomenal that she's training technology to help her do her job. So really the unique partnership here is not that we had to build all the expertise, but that we aligned incentives across IBM and Wellpoint. It is really gratifying when you see someone like that, one of our nurses or doctors, our clinicians, working side by side with the IBM engineers that are helping tune Watson. So the piece that we bring to the table is the deep healthcare knowledge, the ability to understand if Watson's not getting the answer right, what's the association in health data that's different than what Watson had to be trained to play Jeopardy? And that's been that teaching process that we've been going through. So it's really a unique partnership that they're bringing the core strengths that they have to the table. We're bringing our core strengths. We have aligned incentives, and that's how we're working on delivering the solution.
And so does it sort of sit in the cloud someplace? Is it at IBM? Do you have it? Are you hosting it?
We signed the deal back in September of 2011, and by December of that year, we had a baby Watson stood up in our data center in Richmond, Virginia, that quick. And we actually had an application that was doing round-trip transactions. So we really accelerated from the point in time, because you have to put it through a teaching process. As we've thought now to the commercialization or industrializing it, we are actually connecting now, our production version is actually connecting to Watson. That's what in one of IBM's smarter data center capabilities, and that's a better approach.
When did you know it was working?
Here's clinicians working on this every day that to some extent will change their jobs. And, but when we looked at the data, 40 to 60% of our clinicians' time was spent on organizing and looking up information. We want them to spend their time on clinically thinking through what's best for our members, what's best for our patients. For me, what matters is not when I believe the technology could work, because I have a technology background, and I was pretty confident when we first started this journey that we would ultimately make it work, is when the nurse said to me that she actually put information in and Watson gave back the right answer. Then she knew it was a light bulb moment, and this was actually going to be able to work in healthcare.
So are you sure yet that it's going to be transformative?
I do believe it's going to be transformative. I think, we are seeing great promise, and now we took it actually out of the innovation R&D mode, and it's actually embedded into our core care management strategy. So I know for that piece of work, it's definitely going to work because we've seen enough promise. The other really exciting thing, if you think about artificial intelligence, in a traditional decision support type system, every new procedure we would present it with, you'd have to program that procedure to work, right? It's structured, language. If you think about what we just did, this was a breakthrough we had in the last couple of weeks. We presented 2 brand new procedure codes to Watson that Watson had never seen, and Watson achieved the accuracy without any further teaching. So that tells you that we have made progress in the training of Watson truly understanding healthcare and how to relate unstructured healthcare information. I think to me, it's more the challenge, because this is tough work. The challenge is more how fast and in what scenario. So to me, it's not an issue of will Watson work or not. Where are we going to find the most value with this new technical capability?
And where do you see Watson having the biggest impact? Is it your operations? Is it for healthcare providers? Is it for patients?
I think in the short term, we're certainly seeing the efficiency, as I mentioned, because 40 to 60% of our clinicians' time was spent on just aggregating and collecting information to be able to make their decision. You're certainly going to see an efficiency factor. I think the longer-term value is, if you look at the work we're doing with IBM and Memorial Sloan Kettering in oncology, and you think about the massive amounts of new insights and research that are coming out, the ability to put at a clinician's, in front of them, the leading research, really tied together with a single best record of my information to be able to match those two together and bring recommendations back to the physician who's ultimately making the decision. This is a tool that I think on driving the affordable cost of healthcare and really moving the needle on looking at, many times today, physicians are trying to eliminate it's a particular condition, so the order a battery of tests. With more intelligence, how can we even narrow down? One of the things that we envision is Watson can actually say, I'm 50% confident it may be this, but if I had this data, I could be 75% confident. And so I really think we're going to see the bigger impact is going after this. How do we drive affordable, quality health care?
How much of your time would you say you're able to spend on things that you think are going to be transformative?
I would say in my role, it's probably 60% of my time.
How do you decide what to focus on? For instance, you're obviously ahead of everybody else with Watson, but some other health insurers have looked at telemedicine pretty heavily, or doing more with live video consults.
It starts with our mission: improve the lives of the people we serve, the health of our communities. So that's the grounding. The three strategic imperatives we've really tried to simplify. Affordability is number one. If we're not looking at things that are really moving the needle in affordability, we believe that's our responsibility, and that is number one priority. It's a big issue not only for the consumer. When you look at median income over an average household over the last 8 years has stayed the same. Healthcare costs have doubled. We have to address this issue. It's an issue for our country. 18% going to 20% GDP. Number one focus, very clear. Affordable quality healthcare. Access, big issue. There's issue with access today. Less than 50% of doctors are accepting new patients. So we're seeing that. Now we see, as we talked about earlier, with healthcare reform, more people coming into the system. How do we make sure? So we're at that tipping point where access is going to become an even bigger issue, which is why you're seeing it becoming more embedded into our strategy. And number three is consumer experience. And that's the other one, how do we really engage the consumer into this equation? We actually have been doing telemedicine for several years. We actually started pilots in California very early on. What's different this time is we're thinking about, going back to what I talked about earlier, it's not just about having a telemedicine capability. It's about how does it tie into. And so when we're doing our work with Live Health Online now, it's very much focused on how's it integrated with my benefits, so that it's not something I go and have to pay out of my pocket, but it's integrated with my benefit solution. How do we make sure it's more that experience? Many of the telemedicine type scenarios, you place a phone call. Ours is very immersive, online doctor visits, much more consumer experience. When we bring up that telemedicine visit with Live Health Online, has my patient record. So we're really trying to connect all the pieces together, which is now why you're hearing us talk more about it, because it's more directly aligned with our strategy.
Well, it sounds like also what you're saying is that to do something transformative is not something where you snap your fingers and suddenly everything has changed.
Yeah, one of the things, and telemedicine is a great one, a lot of times companies look at that because it's a capability I can sell to an employer. The way I think about it is, if it doesn't work for the consumer and the providers, the solution's not going to work for the long term. So in that scenario, absolutely, we had to think and understand, how do you make it work so that doctors will be available online? And so when you think about the payment innovation we talked about earlier, where we're supporting them through reimbursement to do these kind of visits, that's an important factor. If I as a consumer go into this model and I don't have a great experience, again, it won't matter in the end, if you can't make the whole system work for employers, for consumers, for providers. The other thing I would say is we look at innovation, I would say that kind of more generally, we try to bucket it. There's normal innovation that happens in your product life cycle. We always have to think about, how do you get new products to market? How do you do process improvement? That's one type. We also try to look at innovation from the context of, how does it drive long-term value, and how does it tie back to your strategy? That's really important. There's some game changers, and I would put Watson in that game changer bucket, but we have to focus on just a few of those. And there's other opportunities where you can partner with a company, such as what we're doing with Live Health Online for the telemedicine type solution. And then there's also companies we put an investment in so we can get first to market on new capabilities. So we really try to look at the various forms of innovation and understand, you can only make a few big bets, but you can do innovation in many other ways embedded throughout your business and drive a lot of value to your company.
So what would you say, besides Watson, are your big game changers?
We have this issue. Electronic medical records really aren't moving the needle. If you go back to this issue about the amount of data that we have, and just to give you some context, we have health data on 100 million unique individuals from various points in time, right? Even though we have 36 million health members today. And if you think about our enterprise data warehouse, so we do have big data, right? It's bigger than the size of what's stored in the Library of Congress. We have focused our innovations on how do we collect and organize all the information about me, not as a member of a health plan, but as an individual person. My daughter went to the pediatrician, had some issues on her local tests. We had to send her to Children's Hospital. What did I do when I first got there? I had to give all of her background, her history, document all the things that we have, document her history. The story then goes on is that as the pediatrician was calling me to say, call me Monday, I was assuming I was getting the health results. Having worked in this industry, I simply said to Children's Hospital, do you have an electronic medical record and can I get access to the information, which I did. So by the time I left Children's Hospital and got home, I had my daughter's lab results and I pretty much could self-diagnose what the issue was going on, and she had iron deficiency anemia. I called my doctor Monday morning only to tell me that they were waiting to hear from Children's Hospital and were waiting for the lab results, in which I said, I have them, would you like them? My point in this simple example is we have to help facilitate the integration of information to get people the care they need. In this, what we call a longitudinal patient record, I think it's a really important innovation. We'll do mobile, we'll do social, we'll do all those kind of things, but Watson that can help us sort through massive amounts of information, unstructured data, ability to aggregate information. And if you think about it, as we're talking about new reimbursement mechanisms, part of that discussion is what data, ours and the providers, do we need to start bringing together?
And does that mean, for instance, if your daughter ends up, say, working someplace where a Wellpoint company isn't the insurer, and she's had Wellpoint subsidiaries as her sort of insurer prior to that time, where does that data go?
This is actually an issue we're working through now, because as we've started to expose some of our hospitals, physicians to the information that we have, the first question that comes up is, can I have that for all my patients? And so we're actually thinking through how to think about that model going forward, and how do we really make sure, for us this has to be a cloud-based solution, but obviously that's something that over time we have to really think through.
And do you have to build that yourself, or is that not clear yet?
We don't have to build the capabilities ourselves. In this case, we're really integrating technologies together and bringing a solution forward. But I believe, it has to be a cloud solution. It's been really challenging for delivery systems to implement electronic medical records. Their resources are generally very thin. How do we make something simple to get access to? That's going to be important as well.
So in a place like Microsoft's Smart House of the Future, where you've got sensors that are feeding data about the environment and about the people in the environment to different systems to be interpreted, are those the kinds of things that will also become transformative and will then feed into the data that you want to gather or that a patient is going to have? What happens with those, and do they transform things, or are they just sort of nice little research experiments?
Everything is becoming censored. Everything's becoming wired these days and generating lots of information. I think the key point around this goes back to, I absolutely believe for it to work, it has to naturally fit into the consumer's world, right? And so I really think over time, we've had monitoring devices out there for some time. Why haven't they gotten adopted? Sometimes it's challenging to use them and plug them in. Technology keeps getting smaller and smaller. It's this Moore's Law thing, and processing faster. And when you start to think about the capabilities, some new innovations that are starting to emerge, an EKG that's really a case that fits over your smartphone. I mean, I've tried it, it works fantastic. Those kind of things. It's not something different. I have my smartphone. How can we fit into those kind of things? That's what I like about telemedicine. It's taking the doctor where the consumer is. As the consumer's in their home, I think there's lots of information we can think about. We actually do some of this today in a subsidiary we have called CareMore that really focuses on that Medicare Advantage. And we actually have those seniors actively manage their weight. And we can see that if there is a rapid increase in weight gain within a particular day, someone needs to reach out to them because they may have an accelerating health condition that we want to intervene before they end up in the emergency room. But it's got to be simple, and it's got to fit into the consumer world. We have to keep thinking about the design, because that, I think, is ultimately what's going to drive the engagement with the consumer.
What are the biggest obstacles organizationally to transforming your operations?
I think this is one of the most transformational times we'll ever see in this business. And our industry has been slower to transform, I think, and a lot of things have been tried in healthcare. So I think for the industry in general, and also some of the challenges we face is, not making sure that we're not looking at things based on where we've been, but where the market is going. And also making sure we're not just paying attention to what's happening in our industry. I think there's a huge intersection, as I mentioned earlier, with what consumers are expecting, how they're engaging with technology. We have to capture that.
I just want to throw a chronic care question at you in our last couple minutes here. So chronic care accounts for something like 70 to 75% of all healthcare spending in this country. Do you feel like an insurer can really sort of change that in some way that's going to be meaningful?
Yeah, I mean, when you really look at what drives the cost, this is the crux of the issue. And when you look behind that, there are many behavioral related items that come into play. Are people staying compliant with their medication? Are people managing smoking and weight and many other things? And so this is really a tough issue. But one of the ways that we have to look at it is not just from a medical perspective, but what are the social and behavioral elements of solving that problem? So that goes back to working across all the people that are giving care, not even in the traditional sense of a medical doctor, but sometimes there's social workers involved and other things. When we look at that in our models of managing Medicaid or managing Medicare, these issues are incredibly relevant. So again, we believe it's around aligning the incentives, bringing all the stakeholders to the table, having the integrated data as well, and understanding that it's a combination of both the social, behavioral, as well as medical issues that we have to solve to solve that problem for the long term.
So would I call that a cautious, yes, we can change this problem, or?
We have to change this problem. And I think, when you look at our CareMore model in Medicare, it's demonstrated that we've been able to reduce readmissions to hospitals. We've demonstrated that we've been able to reduce the amount of diabetic amputations, real proven facts around those topics. So yes, we absolutely have to. Yes, we will. We have to. And if we don't address this chronic care issue, not only for Medicare and Medicaid, but across our other lines of business as well, we're not going to get at the ultimate cost issue.
Well, Lori, thank you so much for sharing your insights on digital transformation with us.
Great to be here. Thank you, Michael.
This is Michael Fitzgerald with MIT Sloan Management Review. Thank you for joining us for this discussion on digital transformation, and we look forward to having you join us for our next one.